Hi, this is Dan Ratner, and thank you for tuning in to Crushing Doubt. On this episode, I have Dr. Jeff Axelbank, one of my colleagues in Mind Body Healing. We're going to talk about his own experience with chronic pain and how he came into this work, the direction of the field, and multi-generational trauma. If you haven't already, click subscribe, ring the bell for notifications, and put your comments below. I'm here with Dr. Jeff Axelbank. He is a doctoral level psychologist like me, has a PsyD. He has a huge wealth of experience in psychodynamic therapy, as I do, but he's also an organizational psychologist, which means that he works with businesses and the functionality of teams. He's got an impressive array of consultations from schools for autism to violence prevention in high schools to medical residencies to law firms. You do it all. So, Jeff, I wanted to welcome you to the show.
Thank you. It's a pleasure to be here. Thrilled to be here.
All right. Well, I'm glad, and you and I have had a chance to talk one time. We've emailed over the years. One of the reasons I wanted to connect with you, we are on the TMS listserv, and for new listeners, I'll just say what that is. TMS is called tension myositis syndrome, but that's what Dr. Sarno's name was for a mind-body process. So we connected on how we work with mind-body issues. So, Jeff, the first thing I wanted to ask you about, I always want to know about people's personal experience with this. How did you get into this work? How did you come to it?
Yeah, I think we all of us in this work come to it from some personal reason. Many of us for ourselves, some for family members. For me, I grew up as an adolescent. I was always getting neck aches and stiff necks, and I'd wake up in the morning and unable to move, and my mother would say, well, you must have slept wrong. There must have been something about how you slept. Your pillow maybe wasn't quite plumped up enough or something. And as I got into adulthood, I had these episodes of neck and upper back, mostly for me. And I started going to a chiropractor, and the chiropractor took an x-ray and told me I had all these subluxations in my spine, and I needed, if I didn't come for regular adjustments, that I was going to have some major problems. And so I was going like once a week, sometimes every other week. And then when I would have an episode, it was always the question of, do you do cold or do you do hot? Everyone
Right.
everyone has, there's all kinds
Those
of
were your
opinions
choices.
about that, right? I sort of struggled with that, just for years and years and years. And then fall of 2002, I had what I consider the mother of all back spasms. And it really sort of laid me up in a way that previous ones hadn't. And I was sort of on the floor, couldn't move. And I did what I knew how to do at that time, was cold. I was doing cold. And I was going to my chiropractor, and he was like, oh, you really need to come like twice a week. I was coming twice a week for adjustments. Over maybe a couple of weeks, it just didn't get any better. And I started getting shooting pains down my arm. And I went to my doctor, and my doctor had me take off my shirt, and he said, oh, your back muscles are already atrophying. This is really serious. And he warned me, because of the nerve pain I was having down my arm, that if I didn't do something, my arm was going to become not usable, and
Wow.
gave me some warnings about not I shouldn't ride a bike because you're hunched over the handlebars, and I shouldn't swim because that puts stress on your neck. He took an MRI, and the MRI showed herniated discs, bulging discs in my neck and my upper back, and prescribed non-steroidal anti-inflammatories and muscle relaxers, and continue the chiropractor and go to physical therapy, and don't rake leaves, and don't run because that jars the spine, and all kinds of other stuff. And so I'm a good boy, and so just like my mother told me, do whatever the doctor says.
Right.
And
Right.
I did all of that, and it didn't help at all. Just continued like that, and I had even moved the chairs around my my office so that I was now sitting in a hard chair rather than a soft chair because I was a little more comfortable. And then I got this phone call from my sister-in-law, who is a hairdresser, and I knew that she had had back problems in the past, but she said, "So Jeff, how are you? How are you doing?" And I was like, "Well, I'm okay," the way you say when people ask how you're doing. And she said, "How can you say you're doing okay when," and I thought she was going to say, "when your back is out like this."
Right.
But what
Right.
she said, she really surprised me. She said, "How can you say that you're okay when your daughter just got diagnosed with type 1 diabetes?" I was like, "Wait, what are you talking about? What does one have to do with the other?" And she basically said, "Let me send you some books." And she sent me Dr. Sarno's book, Healing Back Pain and the Mind Body Prescription. And I'm a psychologist, so I was sort of predisposed, I think, to believe it. But I had the MRI, which showed, I could see on the MRI the bulging disc, the herniated discs. I could see how that was impinging on the nerves. But as I got tuned into thinking psychological rather than thinking physical, I started to notice how the pain would wax and wane depending what I was thinking about or depending what I was talking about. And it started to make sense. And so I think of the three pillars of John Sarno's approach, which is: one, think psychological, not physical; number two, stop medical treatments; and three, resume normal activities as soon as possible. So I started to shed the physical remedies. I stopped the physical therapy. I stopped the chiropractor. I weaned myself off of the muscle relaxers and the nonsteroidal anti-inflammatories, and it didn't get worse, and it started to feel a little bit better. And then I said, well, the third pillar is resume normal activities as soon as possible. So my first foray was back into the pool, swimming. I was doing a lot of swimming at the time. And the other thing Sarno says is get in touch with your anger. And so I remember the first time I dove into the pool, and it was very, very painful. And I just started screaming, underwater, and I'm screaming about how angry I was about my daughter getting this terrible chronic illness, diabetes. And it took about 2 weeks. And in 2 weeks, I was totally pain-free. And it really was, eye-opening. So this was 2002, probably by this time was probably winter 2003. Since then, I've really had no major problems. Occasionally, like all of us, I have twinges. I might have a back spasm, but I can really nip it in the bud by thinking about what am I thinking about at this moment that's making this happen. And when I do that, and also don't, retreat into bed, it generally goes away in an hour, 2 hours. Sometimes it takes a day, but nothing like what it used to be. And I could go months and months, years without having any of these episodes. So I'm a believer.
Yeah.
It
Well, and
sort of erased the doubt, as I know this is what this podcast focuses on for me.
absolutely. I mean, seeing is believing, but it's really interesting. Even now, I've been pain-free for 10 years. Now, my odyssey went for 8 years. So, one of the responses I had as I heard you, well, it was really interesting. As you were describing things, you were describing things that I had heard, that I had felt myself, but I haven't actually necessarily heard in individual stories. Things like that hardback chair being more comfortable,
Right.
or getting all this information from people that would only make you more afraid of things.
Right.
And your description was so spot on with what I experienced, including that my pain, essentially, when I really started to get the Sarno thing and work with it, it was probably 2 to 3 weeks. in that time, it lessened. And one of the key points was that when I stopped doing the other things, it did not get worse.
Right. Yeah.
That was staggering to me. And so this is part of how I came to the idea that doubt has a role to play here. Sarno talks about the emotions, and of course they play a very key role, especially in the onset of things. And so It's wonderful that you had somebody who could tell you these things. And I loved that moment when you were like, what do they have to do with each other?
Right. Exactly. Yeah. And, I have seen this thing about the doubt as the sort of the final key happen numerous times with my patients where, they'll be like 90% better, but then there's this one symptom that just won't quit. And, we'll talk about, do you really believe, with, I heard Sarno say, with 2 feet, you got to jump into it with two feet. And when people do that, it changes things. It definitely changes things,
Yeah, and so actually, I wanted to ask you: it sounds like you really do work with doubt. I don't know if you talk about it in that terminology, but it is about full belief. And one thing I love that Sarno said, one of my favorite quotes of his, is you don't need a leap of faith; you need a leap of understanding.
Interesting, yeah.
And so I think it really, if you're going to jump in with 2 feet, one thing we can offer our patients is, well, let's talk about science and logic and why you can leap in with 2 feet.
Yeah, I want to take the doubt issue to a deeper level, though, because there's the cognitive issue about understanding and taking the leap about is this physical or is it psychological? But once you start thinking psychologically, that's in a sense when the real work begins, because people start to have to face some very difficult things, like in some cases it's abuse that they suffered as a child, and there's the question of doubt comes in, is like, did this really affect me? Like that was years ago. Like, why can't I get over it? And or in my instance, there wasn't really sort of overt abuse, but there was sort of emotional not being tuned into me. And I had some medical trauma early on that seemed like, I was 2.5 years old when this happened, this medical trauma. And is that really affecting me? And I think the doubt can get in the way if you start to wonder, because the fact is that our nerve circuits are formed very early on. And people say, well, why don't I want to live in the past? Well, I say, well, but the past is living in you. And and that's real. And if people can erase that doubt, that really helps to get closer to the psychological issues that are affecting you now, which no one really wants to look at. But when you do, first of all, the pain goes away, but also it changes your life in other ways as well.
I mean, if I could just bottle up what you just said and have everybody understand it, I would, because it's
we
brilliant.
Are bottling up.
Right,
we're recording, right? So
that's right. We're gonna let it out. We're gonna let the genie out of the bottle. So
right.
One of the things I loved about what you said, though, is that it really is true. When I talk about crushing doubt, first of all, it has a double meaning. Crushing doubt, if you use crushing as an adjective, is what we experience before we get rid of the pain. And what I always say I'm not about just annihilating doubt without letting it in. You have to let it in. Yeah. So you can't crush doubt that you're not in touch with. And what you're talking about is such an important point, because yes, there's the cognitive doubts you have that maybe you could get help with from reading a book. But when it comes to the doubts about you and did this affect me, that's emotional. That's from the heart. And I had an example of that I know you will relate to from our conversation before. I had early childhood trauma also. And I did have the feeling of, I'm not going to make this a big deal. I'm bigger than this. It
I'm
wasn't
over
that
it.
big of a
Right.
deal.
Yeah.
And it wasn't until I accepted, no, I don't have to be a victim, but I also have to let in that this did profoundly affect me. And it made me have doubts. I mean, what happened for me is my father died when I was 6 weeks old. And so there was a narrative in my head of, well, how could it affect me that much? I didn't even know him. You know what? But I did grow up in the absence of a father in certain ways, even though my mom remarried and he then adopted me. But all of that stuff had me doubting my identity.
Right.
So much doubt. I
Sure.
mean, part of the reason I came to this idea is that I have so much doubt. It's not that I have no doubts. I just know how to deal with doubt now. And I've let it in on that profound level. And I know you did too.
Yeah.
And there was, go ahead.
You can identify it and work with it as opposed to denying it or sort of pushing it off to one side.
Exactly. So if you don't mind, I'd love to hear about this event when you were 2.5 or so.
Yeah. So I had surgery. I had an umbilical hernia when I was 2.5. My parents um, went to the doctor. I had this like bulge in my navel area, belly button area, and the doctor said, sure, we can fix that, but I'm actually also really concerned his circumcision wasn't done properly, and that's going to cause him problems when he gets older. So what, as long as we have him under the knife, under anesthesia, we'll take care of that also. And I had this at 2.5, this experience of being in the hospital and being under anesthesia, and having a very private part of my body cut. Usually a circumcision happens when a baby is a baby, a real neonate newborn. And there's also some questions about, is there trauma with that too, but certainly when you're 2.5, your brain is much, much more developed, and so there's that experience. But then there's also, in those days, this was in about 1960, 1961, they were not so enlightened about putting children in the hospital, and so my parents were not in the hospital with me. Also, in those days, they kept people in the hospital for a long time after surgery. Nowadays, they want to get you right out. So this was an experience. I was in the hospital, I'm told, for 5 days, where my parents could come to see me, but at night I was all by myself. And I think that was really traumatic, about being separated from my parents. Um, and there's some legends. I've been told that when my parents would leave, um, I would be standing with a nurse by the elevator as my parents went in the elevator, and the elevator doors closed, and then I'm left all alone. And I can just imagine how horrible um, that experience was.
Yeah, and I think it's really interesting because as a human race, we have this wish to deny trauma, even to ourselves, or maybe mostly to ourselves. Because if you think about it, if you described a story where your parents brought you to the woods and just left you with a stranger,
Right.
and then left, from a 2.5-year-old perspective, they don't have the ability to understand the difference between those two things at
Absolutely.
all.
Well put. Well put. Yeah. There's something else I want to add that I was just realizing as you were talking about your history, about multi-generational trauma, because
Oh, yes.
my mother, her father died when she was 2. And she would talk about that, but it was one of these things where, yeah, that happened. And then, my mother was a single mother, and, she took in people to rent rooms, boarders, and there were, the family rallied around, and so there was a sort of a denial of really how traumatic that was. But I think her sort of denying her own trauma her own sort of abandonment at that age, same age roughly that I was in the hospital, probably blinded her to the trauma that was going through. And it's a way that multi-generational, that trauma gets transmitted from generation to generation. I'm hoping that by being in therapy and looking at this, that I have not transmitted that at least too much to my kids, trying to be more in tune and empathic and compassionate. Um,
It's a wonderful point. But you also just kind of blew my mind, because I was thinking about this. One of the major things that I've connected to as I've come to understand my own trauma is that, you know, the story of my father's death was something that when I would talk to anybody about it, they all had opinions about it. They had these ideas about what it was. And it wasn't until I embraced my own story that I could tell the story, but I didn't even know the story. It took me a while in therapy, really through the mind-body process. My body told me more about this than anything. Right. It was through my body that I got to the connection of, whoa, this is real and this is deep. And one of the things I came to is that my father knew he was dying, or at least I think so. Maybe he was in denial, but he had cancer, and it was bad. And he didn't write anything to me. It was the only way that he could have communicated to me. And I smiled a little bit when you were telling the multi-generational story, not because it's a happy thing, but because his mother died when he was 6.
Wow.
And I think you hit on something, that he was blind to what this would do to me, and that he did need to write that letter or something.
Right. Some way to connect with his son. Yeah.
And you know, my mom had a different kind of trauma history. Her father had died 3 years before that. So even though that wasn't an early childhood trauma for her, I think that blinded her to what does death do? What needs to happen here? And I mean, I ended up, I write songs, and which I've only been able to do in recent years, probably through mind-body work. And I wrote a song called No Letter, and it's about this moment of not feeling valued enough for him to say, hey, I wanna pass on something to you. And what you're saying, I think, is so important. What he did pass on to me, I'm sure he would be horrified to know this, but he passed on that multi-generational trauma. And so this is one area where I think the mind-body experience is so important. So I want to shift gears for a sec, because your organizational background is part of what drew me to you specifically on the listserv, because I felt that you and I are two of the people that are talking about big change. How do we alter the conversation, maybe nationally, or at least with the group of providers that's out there that knows about this stuff? We want organizational change. I wondered if you could just talk a little bit about how you're seeing it and what you would want to see happen for real change to happen.
Yeah, it's an interesting question. I just this morning had an exchange with someone on email about sort of almost exactly this issue. So if you look at the history of mind-body stuff for the past 50, 60 years, like when I was a kid in the 60s, a lot of people had ulcers. It was kind of a major thing. It was on TV, and people were talking about it a lot. And then at some point, it was discovered that what was causing ulcers was stress. And I don't know, it seems like in the past 20, 30, maybe even 40 years, ulcers have kind of disappeared from the radar. I'm sure they're still out there, but there isn't the epidemic of ulcers. Instead, what we have is an epidemic of back pain, carpal tunnel, repetitive stress injuries. I think people say, well, we have these repetitive stress injuries because everyone's working on their computers, But then I think of the secretarial pools of where there were like hundreds of women lined up on typewriters, and there was no such thing. It was this was not a thing, And so I think that there's something on a deep level for us humans as a species, where we need something. So there's a resistance, I think, for big change in terms of addressing this, because the minute that something is discovered to be a stress-related thing, we'll find something else, whether it's fibromyalgia or chronic fatigue or something else. At the same time, another big issue, a systemic issue, is the financial incentive. Certainly the pharmaceutical companies want us to keep taking Oxycontin and nonsteroidal anti-inflammatories and muscle relaxers and injections into the spine, and the doctors really want to that's how they make their money, by doing surgery and doing invasive procedures. So there's going to be systemic pushback on mind-body stuff, as well as, I think, an emotional sort of species-specific resistance to really seeing this. So what do I want to see happen? I mean, I'd certainly like for the financial factor to be not as much of a factor, but I have to say I'm not that optimistic that overall this is ever going to go away, because just like our symptoms, if an individual, the symptom will like kind of move around. If you decided that your back pain is not caused by a structural issue and you don't really do the emotional work, next thing you'll have plantar fasciitis in your foot. And just like that, on an individual level, on a social level, on a societal level, our epidemiologically will shift from having ulcers to having back pain to having carpal tunnel to having fibromyalgia, and who knows, I don't know where it will be in the future, but I'm sure that it will go somewhere else in our bodies, in our collective bodies.
Well, I'm curious what you'll think about this, because as you were saying this, my mind is always evolving on this. I've been writing a book now for a long time, and the book gets better and better the longer I don't publish it, because I just keep learning more stuff.
Please don't publish it then.
No, don't stop learning. But listen, I'll just start writing another book. But I'm near the end of completing it, which is exciting. But I actually am a little more optimistic at the societal level than I am at the individual level that we will ever stop having TMS. And here's why. I think what you're saying is right on. I call it TMS sometimes, mind-body syndrome other times, but it's all the same thing. A mind-body syndrome is really just the human condition, isn't it? I mean, in some ways, it is something that we all have to some degree. I tell people this all the time. I have some kind of mind-body symptom every day, but it's small. Very small. It's almost like it's my body talking to me. My body talks to me every day. And if you're listening and you understand how to deal with it, then you can cope with it. You can learn things from it. I don't mind it at all, because it's just telling me things. But now, I don't want you to think that I'm naive, because the societal part is going to be very hard. And I'm talking about change over maybe the next 30 years. But here's my hope for it, and the reason that I have some hope for it. I think from a human perspective, people are always going to have mind-body issues. But if we become aware of it, then we can kind of minimize the damage of that. From a societal standpoint, the reason I have some optimism, and maybe you and I can put our heads together, because you've got the organizational expertise and I have some greater hope, is that what I have seen, at least in America, is that when the tide turns on a belief system, it changes what happens, even in business. It drives the business differently. So let's take gay marriage, for example. George W. Bush, I'm not going to get political on either side, but George W. Bush ran on a campaign that was about, marriages between a man and a woman. That was in 2004. In 2008, Barack Obama won with, I wouldn't say it was a major part of his platform that gay marriage was a right, but it was only 2 years after that, I believe, 6 years after George W. Bush won an election with that as a major part of his campaigning. It changed because society changed, and the younger generations, I think, are getting better in certain ways. They're getting worse in others. Well, that's a different discussion. But I think we can change this. I think if we bring enough people into the foray that they understand this, that the pressure will become enormous to change this. And so look, there's a part of me that's always been this way, and maybe it comes from my background where I came from trauma, and I was like, "But I can do it,"
Yeah, sure.
But I'd love to kind of put our heads together about this, because I think you understand what it takes to make change. And one of the things I love about the way you work is that it's psychodynamic, meaning that you understand the feelings involved underneath and the unconscious part of the experience, because we're going to need to deal with that. We're not going to be able to take the pharmaceutical companies and get them to see what's going on in their unconscious minds that leads them to be like, no, this is right, But that's an important point, because they don't think that they're doing anything wrong in general.
Of course. In fact, they would say that they're providing, a service for sure. And in some ways they are, it's very, I guess the difference is it's penny wise and pound foolish, or it's very short term with some long term costs.
Absolutely. So I want to continue this conversation with you. If you wouldn't mind, I'd love to have you on again.
Sure. Happy to do it. It's been a pleasure. I just want to say one thing that you said, that I think one of the beautiful things about Sarno and his writing is he really, and part of why it's so compelling to people and accessible and people drop their defenses, is that he makes the case that it's universal, that this is part of the human condition. And he talks about his own migraine headaches and other problems that he had. And I think it normalizes it in a way that people can see that I'm not so weird. This is not such a crazy thing that's happening to me. It's happening to everybody all over the world, all the time.
It's a great message to end the interview on, Jeff, and I appreciate you highlighting that, because it really is true. If you're suffering out there, you're not weird. You have something that we can understand, and that actually everybody has in some degree. And those people who don't understand it, unfortunately, they might have this later, and we need to help them all. So, Jeff, it's been a pleasure having you on.
Thank you. Been a pleasure for me, a privilege.
All right. Looking forward to more talking with you. Well, that was such a great interview with Jeff Axelbank. He's such a pleasure to talk to, but it's also, he's a real kindred spirit in a lot of ways. We keep finding connections between us. And one of the things that I was struck by, though, when you hear a story that has a similarity to your own suffering, it's very soothing. It was soothing to me, even 10 years later, to hear somebody say they had these spasms that led to fear, and he went to the chiropractor twice a week. I went to a chiropractor 3 times a week at one point, and I thought, there's something wrong with me. Why is everybody else different here? And so when we hear the stories of other sufferers, it really does help us. It's one of the reasons that I do this podcast, is to be able to bring you guys the material to know that there's nothing wrong with you. And in fact, we also hit on the fact that this is part of the human condition. Now, how we deal with that human condition and how much we have to suffer because of it. Oh, there's a mind-body issue right there. I don't know what it was. I'll have to analyze that later. But it's part of the human condition that we have a mind that affects our body. And so as we start to adjust that, that's a huge part of where we can get relief, because chronic pain is hard enough to deal with, but feeling that you are lesser than or weird in some way, or that there's some riddle that you pose that other people don't, that's another way of suffering. And so I do want to keep highlighting the ways in which we suffer from this and the ways we can get through it. I was also really struck by his comment about multigenerational issues. I hadn't been thinking about it going into the interview, but as he brought it up and as I was thinking about it, and it's something I've thought about before, but maybe not as much as I should, that a lot of our traumas, once we start thinking emotionally and start paying attention to them, they are kind of passed down generation to generation. I think about this in relation to my daughters, because the ways I've made adjustments in my parenting, I thought overall my parents, my mom and I call him my dad. He adopted me when I was 6. It came into my life when I was like 1.5. So the way my mom and my dad did things, overall, they did a great job. They were among the best parents I could have had, but they did have their issues, and everybody does. And those are things that I'm trying to iron out with my own kids and not pass on to them. And one of the things that I like to do is to listen, to really take the time to listen. We're going to have segments in this show that talk about parenting and how to do it, which is not to say that I'm a perfect parent, but like what Jeff says here, we have to be aware of our own trauma background. And if we are denying our traumas, it will not only come out in the body, but it could come out in how we parent, how we interact with people. So we really affect each other in some major ways. Now, one of the things that I was also struck by, and this is why I love talking to other practitioners in the mind-body world, I hear about connections that we have. So to hear that he essentially works with doubt also was gratifying to hear, because, I created the way that I work based on my own experience. I did not, I read things and I worked on things to get to that point, but it really was from my own experience and recognizing that when I have doubts and fears, when I had fears, I would have spasms, and when I had doubts, I'd have more pain. And I was like, this can't be a coincidence, as I discovered Sarno and kind of looked into it. So that was really an amazing part of hearing from Jeff as well. And then lastly, I'll say the fact that he thinks organizationally, that he thinks about the big picture, even if he can be a little pessimistic in a way, and I'll work on him about that, he brings such great thinking to this. And I think if we start to help people change as a society, that's where things will change. And that is really, there's 2 reasons I'm doing this. Well, no, sorry. There's 3 reasons I'm doing this podcast. One is that from my own personal experience, I needed to pass this on to other people. It felt like almost from a spiritual level, like the thing I had to do. Another is that we are going to get societal change by talking to each other. So when I talk to you guys, you'll talk to other people. We need to spread the word about that. And then, of course, the third point is because I wanted to actually help people. And there are some jaded people out there who say, oh, no, you're doing this for your own good and stuff. And look, maybe that's true to some degree, but I think they've been reading too much Ayn Rand. I want to help you guys get better from the suffering. But if we can spread this to society, we have a chance to change things in a major way so that future generations and people we love and ourselves are not suffering so much. Thank you for watching. We're going to have Dr. Axelbank on again. I can't wait to talk to him more about all kinds of things. We're going to discuss things such as stuttering. He is a stutterer, and I wanted to get that perspective on here. So stay tuned for that. Thank you for watching. Click subscribe, hit like, and ring the bell for notifications. Sign up for our newsletter on crushingdoubt.org for information on new episodes or to sign up for my live seminars. For questions you'd like answered, please email info@crushingdoubt.org or put your comments below. I am here to help you resolve your doubts on your journey and find powerful, peaceful, and happy living.